Good evening to all our viewers. In the recent times, demand for quality in healthcare services has risen due to various market forces such as medical tourism, insurance, corporate growth, and competition. As a result of these, the expectations of the consumer for best in quality has also risen, which has indeed led to an introduction of national and international accreditation bodies to act as a quality assurance mechanism, thus enhancing the customer's access to better healthcare systems. Today's session is on the impact of accreditation on the quality of healthcare services. This is to commemorate the World Accreditation Day celebrated on 9th of June every year. This year's theme is supporting the implementation of the Sustainable Development Goals, that is the SDGs. We have a very special guest with us here today. Please welcome Dr. Savitha N. She's the founder, CEO of Mediquality Healthcare Services. She's also a clinical microbiologist, and with a vast teaching experience, currently she is the head of the quality department of SDUMC Kolar in Karnataka. Dr. Savitha has over 21 years of progressive experience in patient care, team building with a leadership quality and motivational attitude. She has a special interest in building hospital infection control teams and training of the hospital staff on disaster management. She has also empaneled as NQAS Assessor for Public Health Facilities, Ministry of Health and Family Welfare, Government of India, and NABH Assessor for Entry-Level NABH Quality Council of India. Dr. Savitha has been a consultant for hospitals with expertise in training, gap analysis, hand-holding for NABH, JCI accreditation, and certification programs by helping them implement the standards. I would like to remind our speakers here, in case you have any questions regarding the accreditation hospitals or anything else, please feel free to drop your queries on the Q&A section below. Your questions shall be taken up in the end of the session. Without further ado, I would like to welcome Dr. Savitha to start the session.
Thank you, Darshika. Thank you very much. Without wasting time, I'll just share my screen. So good evening, friends. Thank you very much for joining this evening, where we'll discuss on the impact of accreditation on quality of healthcare services. Well, I assume that most of you know about the accreditation process in our country and how this is, gearing up over time in India. It's been at least 10 to 12 years. We are actively, aggressively taking accreditation forward across the healthcare sector. And especially to commemorate the World Accreditation Day today, we are again discussing this interesting and an important topic. I'm Dr. Savitha. I'm the founder director of Mediquality Healthcare Services. You can reach me on the website www.mediquality.com. And the key points of discussion today, I tried to keep my discussion a bit out of the box, and I will be discussing, more of how this accreditation or these certification programs have been influencing our hospitals. So in that, I will discuss on the current scenario, what is happening to our hospitals when they are, trying to get a certification or accreditation in India. What consultants, usually what kind of consultants we are seeing in the market these days, and what is the need of the hour these days. What is a PPP model, whether the government should contemplate on it, and what are the different international accreditations and how it is different from the national accreditation, and of course the technology which is combining with our healthcare sector, how it is a necessity for all of us. So with these agenda points, so a brief on the World Accreditation Day. So 9th June every year marks the World Accreditation Day, a global initiative established by International Accreditation Federation and International Laboratory Accreditation Corporation to promote the value of accreditation. And every year they have a theme. This year, the theme is accreditation supporting the implementation of sustainable development goals. So these sustainable development goals can be seen on the United Nations website, where we almost have 17 goals. So by 2030, we kind of have to achieve these goals where everyone becomes important in the community no poverty, no hunger, and the different goals have been defined. And I thought I must mention these. So these, the Sustainable Development Goals is a priority for all of us, and we all have to move forward to attain these goals by 2030. In them, by accreditation, this is one area in which we could achieve certain goals. Friends, before I start off with this topic, I would like to just brush up our memories with this British Empire in India. We all know the era of darkness. Around 200 years we suffered under the British rule, and we got rid of them in 1947. All of us know that the 200 precious years were taken off from us, and we were just in slavery under them. So you can imagine the 200 precious years went off, and how can we be compared with the Western world and the same health sector and the same health quality in India? Definitely, it's not. It shouldn't be the right way in which we shouldn't be comparing ourselves with the Western world right away. And the second challenge for us has always been the brain drain. In search of better jobs, lucrative salaries, and higher standards of living, the students who take up the resources from here have always been migrating to the better countries, and we have always suffered this by not having the right kind of people at the right time. You and me, all of us know about this. And along with this, there are definitely plenty of challenges in India, like inequality and diversity, and plenty of issues and challenges we have been facing, and we can't expect the same quality healthcare all of a sudden and start assaulting doctors or nurses or people who are working tirelessly in this broken system. I should definitely not say a broken system, but this is something we are all coming up with. We are trying to progress amidst all these challenges. So we all must understand that we have our own challenges, and definitely we are all taking it in the right way. So this, in spite of all this, we suffered and we are suffering. Healthcare is always, now definitely it's one of India's most rapidly expanding sectors, both in the terms of revenue and employment. And we are progressing, almost, in par with the other countries' health sectors. But definitely we cannot be the same as them. But then let us see what are our challenges and how, accreditations are becoming so difficult for us. And definitely, we will have to be critical about it as well. We can't hide it. But let us see how, look at the negatives of our health sector and also see how we can modify it and improve it. Now, definitely, when we have hospitals of this stature and this caliber, we have to appreciate ourselves for having come out after independence to such a level where we are in par with many, many hospitals in the world. So accreditations, when we look at the current scenario in India, friends, we are not in a very nice place. Accreditation is a voluntary program. So this is to start with, especially to the beginners, I would like to say that anybody can ask for an accreditation. The accreditation agencies don't come to any hospital and they do not say that please go for an ABH or go for an NQAS. So it is the hospital's voluntary, it's a program which the hospital opts for, and they go to the NABH website and they apply it and they say, please come to our hospital and do the inspection and give us a certificate or accredit our hospitals. So it is completely a voluntary program. So this, was the importance of accreditation was well understood by the Western Hemisphere very early. But when it comes to India and Asian countries, this over the past decade only, we've been driving aggressively and motivating the hospitals to apply for accreditation so that they come under the quality of the loop. So we all know that in India, most of the hospitals, they are not for the, patient-centered quality still. Only when it comes to accreditation, when they apply for accreditation, at that time they start developing, this culture of patient-driven quality program. So presently, when we look at India, we have different accreditation programs which the hospitals are going for. Let us concentrate on the small nursing homes in our country, which are definitely choosing the entry level NABH program, which has very limited standards, about 47 standards, and they are trying to put those standards in place, and that itself is a big challenge for them because they do not get any kind of support from anybody. You know, these private nursing homes thrive completely on their own self. Even for certain licenses and certain certificates, they go on spending all by themselves and they do not get any support from anybody. So in spite of that, when they are going for certifications, it's something we all must appreciate and motivate them. So there are different accreditation program, and the entry level is called as a certification. We also have a full NABH program, which is called as accreditation, which many hospitals are going for. Other than this, there are many programs like nursing excellence, blood bank accreditations, emergency medicine accreditations. So there are plenty of them which individually they want to go for accreditations and prove that they have a very good quality. And they are also taking these certificates, over time, second cycle, third cycle. They are going on taking it, which is very much, should be appreciated in this country. And of course, there are international accreditations in India, and mostly we see people talking about JCI. And of course, we all must know what are the different other international accreditations which are also equally good. And let us also discuss how these are different from the national accreditation programs. So entry level NABH, usually it's the initial choice. Whenever a hospital is going for its certification program, they choose to go for an entry level first. And there are many government hospitals which are choosing this entry level NABH programs as well, and trying to show that they are in par with the private hospitals. They are of limited standards and they bring all the hospitals into this loop of quality, and which is very much essential now. So this has also been made mandatory by IRDA, the insurance companies, and also the government schemes. So this is the reason many nursing homes and smaller hospitals are, encouraged to go to apply for these certification program. Now, what is actually happening in India? Now, when we look at our position in our country, how are we progressing? Now, definitely, people have understood that they all need to take some certification on quality to prove that they have some basic quality in their hospitals, and they are approaching few consultants for getting their NABH certification. Now, do all hospital owners know what NABH is? So many of the hospital owners, as per my personal knowledge, see, all this is all my own opinion. Many hospital owners are unaware that it's a basic quality program, and much of it can, they are already practicing a lot of quality in their hospitals, and they can themselves go for an accreditation or a certification without the, necessity of a consultant. Many of them don't know about it. They think that it's a certificate and we have to spend on a consultant and we'll have to get it. They don't even have a glance at the standards of care, and they directly give it off to the consultants to manage. So when they hand over to the consultants, they completely believe that these consultants are going to get them a certificate. So that is kind of going to be a deal that you get me a certificate without even knowing that it is their job and it is their activity which has to be portrayed to the insurance, the inspecting agency. So many consultants, if you have seen, are usually boys or girls who have come out of a consultancy. Many of them are non-medicals and non-medical people, and they have very limited knowledge on the basic quality in hospitals. I know many of the boys who have never seen a labor room, they have not seen an OT or an ICU in their life, they have not worked there, but they are consultants for, advisors, or rather to the hospitals, and they kind of become advisors to the doctors who are so well versed, and these doctors completely rely on them. They believe whatever these people say, and they sometimes even break the OTs or ICUs, and they say this is required, that is required, and they unnecessarily make the hospital owners spend exorbitant amount on these NABH certifications. What they do is they completely load the hospital with signages, and the cut copy pasted SOPs are there all over the place. So without telling the hospital the importance of these SOPs or signages, and usually there is no training seen, whether it's a small healthcare organization or a healthcare organization above 50 to 100 beds also. It is the same thing which is happening, is the money-making business with plenty of OT, ICU, CSSD, alterations will be done with many packages and making the hospital spend a lot of money. Many doctors and nurses of the hospitals generally do not have time, and they don't even want to get involved and to ask or to understand what this NABH program is. Most of the time when these consultants come around to the hospitals, they don't question or ask them. Rather, they think that it is the consultant's job to get them a certificate. So no training of staff is usually done, because even if these people want to do, the hospitals don't cooperate. Many chapters like care of patient, medication management, and HIC is completely ignored in many of these preparations. There are, some fake quality indicators prepared. They usually talk about the fall, sentinel events, staff absenteeism, and they say we don't have any of these, and they tell the hospitals that these are the quality indicators which are important. They generally help out in certain qualified people on these particular days of infections, and they find it very easy that how many ever NCs are generated by the assessors, they can always close the NCs, which is a very easy alternative for a lot of consultants. So finally, when we see that this entry level, usually, I'm talking more of the hospitals in the peripheral areas, it's all a one-day show where they try to cook up, fake up everything. They make a good scene, in the hospital for the assessor, and they say we have this and have that, and finally the assessor either is satisfied or not satisfied. They bring out certain non-compliances, and this is all a one-day show. So after the inspection, now what happens after the inspection? Generally, they kind of work day and night for at least 1 month for the preparation in faking the scene and the data, and totally tired after the inspection. These hospitals, they are very happy that they finished their inspection, they got their NCs closed, and they got their certificate, and they relax for the next 2 years with a board outside the hospital, and they have their seal of entry level NABH everywhere. So this is commonly seen. I don't say all hospitals, most of the hospitals, this is the common scenario, and that's how we see that many people comment saying that why do we need accreditation? This is all, bullshit, where people come and they just look, and we keep some boards and some things, ready, and they come and they give their comments and go. But to be frank, the previous care continues as it was before the preparation, and they somehow go finish 2 years and again call the same consultants again to do the same job, because they think that that is accreditation. Friends, this is not true, because these accreditation agencies are mainly looking at the quality in the hospital. Safety of patients and safety of staff is their prime requirement. So all doctors must understand that they don't really need somebody to guide them. They can themselves pick up a book and read it and bring in entry-level standards definitely by themselves without any support. What is happening in larger hospitals? Larger hospitals, you have some quality teams. Generally, these are very unempowered quality teams where, they usually spend some time after accreditation, and they're completely, they are forced to work day and night before the accreditation date. So they are stressed out in and around the inspection date. So mostly the quality, it runs during and after this accreditation date. So it is mostly, it revolves around these dates. And they hurry up on trainings, and that time, at that moment, they hurry up on different training programs. They start rushing to people. They say, you must know this, you must know that, prepare SOPs. All this is a usual scenario when it comes to larger hospitals as well, it is a one-day show. So friends, this is not accreditation. If you are not prepared from the day one, if you're not collecting your data, if you're not looking, monitoring your practices, definitely you'll get stressed out before the accreditation date. But if you have a proper monitoring system, if you have a well-organized system, there is no need to panic and stress during the accreditation date, and it should just go off smoothly with how many ever accreditation agencies come to your hospital. Believe me, there are hospitals in China which have the accreditation label of so many agencies. They will call all of them who are at their reach, and many international accreditations, and they label their hospitals with so many accreditations. How is it possible? Because they in the day-to-day practices, they involve the quality program, and this is incorporated in the clinical system itself. So they are trained so well. They have their own training facilities. They have their own intranets where they regularly train people, and they bring in quality in their day-to-day program. So the consultants who are actually, spreading the word of quality to hospitals have to behave very responsibly, because they are the ones who are taking the message of quality to many of the consultants who are busy, many of the doctors who are busy in the peripheral areas treating patients. We'll have to guide them properly on what NABH or whatever accreditations are about. So they are usually the areas where these consultants are missing, in training people, is the care of patients. How the care should be given to patients in the wards or ICU or OT is of utmost importance to any accreditation assessor. So when an assessor is looking at your hospital, he is looking at what kind of quality care you are giving. He is not looking at what kind of an epoxy flooring you have, or what kind of a wall and roofing and what expensive material you've utilized. He will only see how your patient gets the best care out of whatever limited infrastructure you have, or whatever you have in your hospital. They will never ask you why you didn't procure this, or why didn't you buy this, or whatever you have. How is the quality care maintained in your hospital? Next, the medication management. See, all of us, in and around medicines in the hospital should know how to maintain the drugs. We should know how to, there is a lot of risk with drugs. Drugs help us. At the same time, they are also that, equally dangerous. We'll have to store them appropriately. There are many drugs which look alike. There are many drugs which sound alike. We may make mistake in picking up the drugs and administering it. So there are many errors happening in the hospital. So it could be the prescription errors. It could be dispensing errors. It could be the drugs administration errors. There could be transcription errors. There could be plenty of errors in the hospital. We'll have to guide the hospitals on how these errors should be identified and how they should be reported and minimized. So these are some important things which many consultants are not delivering to the hospitals. The infection control program. Many hospitals, there are OTs and there are many surgeries happening, many urine catheters being applied, many central lines. Now they should know that what could be the hospital infection rate of their hospital, how they prevent these infections. Many labs and radiations, safety measures have to be explained to them. The facility management, especially how a patient could, you should see to it that the patient doesn't fall off from a stretcher or a wheelchair. How are you taking care of the water? How are you taking care of the building, the fire safety, electrical safety? All this is important. Putting in a nutshell, all this goes in favor of quality program of the hospital. So if the quality is maintained well, they can just call any accreditation agency at any time and ask them to inspect. So, you have to train them on the mock drills. There could be a sudden emergency. There could be a disaster in the hospital. So how do they overcome all this? How do they, the COVID management was such a big failure in our country because we were not trained how to face the disasters. So we'll have to do at least a few mock drills in the hospital and help them understand that these are very important for us to, face any kind of challenges in the hospital. So once you make them aware, they will build up, further. So the HR management privilege, it's important for us to tell them that, they need to employ qualified staff, and they privilege them and give them, certain privileges of, assisting them or conducting certain procedures. And, the anesthesia, the surgery, all this has to be, well explained to the hospital. And of course, the medical records are very, very important data which we have of the patients must be protected, kept secure. And in case the patient requires, we'll have to give them with appropriate, checking if it's the same patient who's come back, and how we destroy the records. All this is important, and everything comes under the quality program of the hospital, which is nothing but what the accreditation agency asks. So the consultants should be very, very well aware about all this and must deliver this to the hospitals. This is very important. Now, when it comes to government hospitals, what I have seen is they ask their own staff, the busy doctors, busy nurses, to go and deliver a training program in the peripheral areas and come back. So when a training program is not effective, what happens? Nothing works out. All your time, energy, money, everything goes wasted. So definitely for governments, it's always better to go in for a PPP model where you have a private-public relationship, where you can invite the private parties to come and train, the hospital staff. Now, effective training methods, you should always incorporate very good communication. You should not do mass trainings, or mass feedback should be avoided as much as possible. Invest in individual trainings. Individual trainings where you help asking questions. You ask them what they have done in their duty time and what better can be done. So all these interactions will always help in a better trainings and better awareness. So consider exactly how people learn. We'll have to see, not all of them learn in the same way. Some of them learn by doing, some of them learn by, their past, talking about their past experience, and some of them learn by, testing them out. So we will have to identify people, talk to them individually and train them. So for all this, we will have to figure out how we can train our staff adequately. Training is not the word, actually training and retraining. We'll have to conduct training programs frequently so that even the people who join newly, they must be able to access the training programs. And you should give responsibility as well as training. So there is something called a 70-20-10 model. It is believed that 70% of lessons are learned through doing the activity, 20% from other people, and only 10% from the courses you conduct. So whenever you do a training, it's very important for you to have some hands-on trainings. So these hands-on trainings only will help the people, the staff, to understand what you're trying to say, and they will also implement it in their day-to-day activities. So create training programs with different learning styles. Like you can have verbal trainings, visual trainings, hands-on training. So you will have to design different training programs so that it could be very effective. In this, definitely online trainings are very, very useful. How online trainings are useful? Because it can be completed from various locations, wherever the employee is, at different places, and whatever kind of work they are doing, they can always schedule the trainings and they can always watch it. Generally, people in other countries have these intranets. They have many training programs where people can log in and at their comfort and read through and understand. And at the same time, they will have tests. They'll have to regularly take tests and pass the tests. So it helps deliver consistent trainings and also allows the administration to track them. So administration also will see that certain trainings are mandatory for all of them, like fire training, or it could be a disaster management training, how to give a CPR, how to give a basic life support. These trainings, every HR, even non-medical people have to be trained. So this, the administration will see to it that all of them are trained on this. But certain trainings will be very specific to pediatrics, OBG, or the other departments. So they can take up those specific trainings at different timings. So we'll have to schedule the training programs in such a way that all of the employees could take up at their own leisure time and make it the most effective use of it. You must always make the trainings interactive. So either use the group work or quizzes or any activity where you are making it more interactive and more effective. Always evaluate your trainings. Your training program should be well evaluated. You ask them, how was the training program? Did it help you? If it didn't help you, why it didn't help you? What do you think should be done? All these kind of questions should be asked, and our basic motto should be to see to it that each and every person understands and delivers it appropriately. So consider the employee demands. You ask them, is it okay for you to come for the training? Is it okay? Is the training helping you? And is it okay to come because most of them are giving care, to patients. So you can't just take them for granted and say, please come for the training. Then who will work in the ward? So all this should be designed effectively. Coming to international accreditations. Now in India, we only know JCI. But other international accreditations are also available, like Accreditation Canada and Australian accreditations, etc., etc. There are many accreditations who are very meticulous and very good. When you look into their modules or their standards and their measurable elements, it's parallel to having quality in hospitals. So they are very good accreditation programs, and India must definitely look at all the different international accreditations. How they are different from the national accreditation is the cost-wise. We all know its international accreditations are a bit expensive, and because you will have to bear the application cost and the surveyors. We call assessors and they are surveyors. So you'll have to bear the cost of the surveyors, and the complete accreditation program is an expensive affair. And the consultancy. Now, if you have to prepare for an international accreditation, you definitely will need certain support from certain consultants. And this again is an added cost to the hospital. But there are certain international accreditation agencies who can give free consultancy, who would, bring their own advisors, their own people. They give you free consultancy. So all this, we need to know which are these other international accreditation agencies. Definitely, you can contact me for more information, and we can guide you on all this, different accreditation processes. And there are many accreditations for the IVF clinics, dental clinics, ambulatory care, blood banks, their emergency departments. All of these can go for international accreditation. Why you want to go for international accreditation is mainly for the medical tourism, because the patients who are outside India can look at the hospitals which are accredited by these trustable agencies. So they would trust your hospital as well, and they would come and get their procedures done at your hospital. So these agencies, there are many agencies, international agencies, who don't just leave you by saying you are not accredited for all the amount you have paid. They sometimes, there are some agencies which will leave you at gold level, silver or platinum levels. Gold is a certain basic level of quality you have. They will give you at the level of gold. If you are, at a better level, they will give you silver. Silver is the basic level, gold, and then the platinum levels. So it is not that you're not wasting any money out there. So there are a few accreditation bodies which are doing very well internationally. So we can look at the different international agencies as well. How international accreditations are different from NABH is, they give a lot of importance to the international patient safety goals. So the international patient safety goals is one thing which somehow is just mentioned as a word in our NABH 5th edition standards. But in international accreditations, even if one measurable element or the objective element, which we call in India, even if one of them is not met, you will not get the accreditation at all. So it is so strict and stringent that they give importance to every standard and objective element of international patient safety goals. So every objective element must be met. So the other standards are same, almost like what we have in the 5th edition of NABH. They also have divided them into patient-centered and hospital-centered standards. So in the hospital-centered standards, we can see they have put their infection control as an healthcare organization management standard. Otherwise, it's the same as NABH standards, but they give, very meticulous or really sensible importance to international patient safety goals, because definitely they are the ones which have to be, which identify them as the patient's safety measures, like identifying patients correctly, improve effective communication, improve the safety of high alert medication, ensure safe surgery, reduce the risk of healthcare associated infections, reduce the risk of patient harm resulting from falls. When you look at these goals, and when you work towards these goals, definitely you meet the patient safety standards of any hospital. So this is what is given very much of importance or prioritized by these international agencies. Of course, technology in healthcare, we all know that technology, from the devices which calculate our pulse rate, our steps, or our oxygen saturation, from there to robotic surgeries, technology has made a very good advancement in healthcare. So technology, by adopting it, we have better diagnosis and treatment of patients with improved quality of life over time, and it has saved many lives. So these, if used appropriately, definitely we can always have a good synergy to store, retrieve data, to reduce the chances of medication errors, it is easier to retrieve patient information, and it kind of gives alerts. If in case you want to keep alerts on medications, flags, reminders, consultations, diagnosis, technology always is there. And in electronic recording of data, this also saves a lot of time and burden of our healthcare staff. So when you look at quality and accreditation during the time of pandemic, how this accreditations and this quality programs help during such sudden devastating times like these pandemics is the incorporation of hand hygiene and use of PPE, infection control screening and monitoring practices, which we have incorporated for the accreditation, holds very, very apt during these pandemics, because these infection control teams we build up, we train, help, they come as very handy during such panicky situations. They come and take over, and especially the emergency preparedness which we train for accreditation programs come to us as a huge help. And many of the hospital managers, they are of great relief with this kind of a system in place. Only when you don't have this system, you will have to suddenly panic and get into all kinds of trouble. Risk management, safety and security trainings which we give during accreditation really helps the hospital to overcome any kind of issues in the hospital. The trained staff always behave in a very matured way, and they handle the disasters very well. The quality culture in the hospital, the way they look at their negatives, they look at their quality indicators, the issues, the problems, they will handle it. They will be trained to handle it in a more appropriate way. Monitoring tools in place, the disaster management, responsive committees will be formed. So this will always help during such pandemic situations or certain emergencies. And the term of adjustment instead of unsystemic reaction, suddenly throwing a reaction, panicking and giving statements. Instead, these people will understand how to overcome these situations. We all must know that low and middle income countries have 5.7 to 8.54 million deaths, according to WHO report, per year due to poor quality care and non-utilization of the health system. So we are the main countries who are, suffering all this just because, we don't deliver quality care. We are having inadequate quality of care, which imposes a lot of cost goes off in, replacing all our inefficiencies. So globally, 1 in 8 healthcare facilities have no water, 1 in 5 have no sanitation, and 1 in 6 have no hand hygiene facilities. So the more we improve and we discuss on the quality of care and we improve the quality of care, and so does our challenges also, can be overcome. In high income countries, definitely they also have challenges. Like 1 in 10 patients are harmed while receiving hospital care. 7 out of 100 hospitalized patients develop hospital acquired infections. So it has been estimated that high quality health systems could prevent 2.5 million deaths and 9 lakh deaths from different infections or different conditions. So more the quality or better the quality, we have a better life expectancy. So quality strategy, which was framed in 2016, very nicely lists the 6 goals in the delivery of quality healthcare, which we all must concentrate. First one is make care safer by reducing harm caused in the delivery of care. That is, whatever care you are giving, give it appropriately by, seeing to it that you don't in turn harm by giving care to the patient. So reducing harm itself is one of the agenda in today's health system. So we'll have to keep looking at ourselves, monitoring ourselves, that we do not give any kind of harm as we are delivering care. Strengthen the person and family engagement as partners in their care. Always remember the patient and the patient relatives, whoever they are our partners in care. So always taking them to confidence, explaining to them in their own language, keeping them in confidence is very, very important for us. Promote effective communication and coordination of care. So within the staff, within the hospital, excellent communication skills, between doctors and nurses and pharmacists, and nurses and housekeeping. A very good coordination helps in a smooth run of the hospital. Promote effective prevention and treatment of chronic diseases. Work with communities, bring in a lot of social activities, camps, and gain confidence in the community, and this leads to a healthy living practice. And make care affordable. So as much as possible, when care is made affordable, people will come reaching out for it, and there will be early diagnosis and early treatments, and the morbidity and mortality will be far low. Thank you very much for your patient hearing. And you have any questions, you can just post it in the chat box.
Thank you so much, ma'am. Thank you so much, I think, for such an insightful talk. We have some questions for you here. The first question is, should small-scale practice setups and clinics be accredited?
Yes. Every, it could be a 5-bedded, 10-bedded hospital to, unlimited number of beds. It could be 1,000, 2,000 bedded hospital. There is no limit for, which, healthcare provider should go for an accreditation. There's no limit. And everybody can apply for a certification or an accreditation. Follow the standards which are defined by the agency, and then you can call them for inspection, and they would come inspect and give you a certificate.
Sure, ma'am. The second question is, what are the essential documents that need to be in place before you apply for any accreditation?
See, one thing I would like to say is the documents are what we use in the day-to-day practice in a hospital. It could be your outpatient prescription form. It could be your inpatient case sheets. It could be your prescription forms in your ward. It could be your own data, your own, whatever papers you are using to document your own details. So all these are the documents required for, to submit to any agency. They don't ask anything different from what we are utilizing in our day-to-day practice. They only want to know if we are giving care. Now, how will you prove that you are given care? Now, how will you prove that you have given care yesterday, day before yesterday? By only writing it in your notes. So a doctor can say that I made rounds at 9 o'clock and I saw this. The nurse can say that the doctor had prescribed this, so I've administered this particular injection. So this can be written in a certain case sheets, whichever or documents you have made in your hospital. So that will be evaluated or inspected by the inspector from the agency, the NABH or the accreditation agency. So nothing different from what you are doing in your regular practice is expected from you.
Thank you, ma'am. The next question is, has the current pandemic affected the accreditation program in any way?
Pandemic and accreditation. See, accreditation is just applying to an agency for them to come and look at our hospital, inspect, and give their opinion about our quality system, how we are giving care to the patients, how we are treating our staff, and they would give their opinion about it, and they would suggest certain if there are any shortcomings. So this is accreditation. But during pandemic, what happens? Healthcare sector is the one which will have to, attend to the patients and give care. So what happens? Maybe applying to an organization like NABH may get delayed because of the care you are giving. But this can always be postponed. It is not necessary that it has to happen when you're busy with your patients, when you're giving care. So it can always be postponed, and definitely even NABH has not been conducting any of these assessments. But for a few hospitals with less than 30 bedded or so, where there are no COVID patients, only they are conducting assessments. So they also do not conduct assessments in hospitals who are busy with pandemic related care and all that. And they always ask the hospital if you're ready for an assessment. They always give the name of the assessor and they say, is it okay with this assessor? So it's all, they always take consent and permissions and they do it. There's nothing forceful on any hospital.
Do we also see any kind of dearth in the number of assessors in India?
I don't think so.
No? Okay.
I'm not the right person to answer that.
Okay, ma'am. The next question is there a facility of acquiring subspecialty accreditation for specific departments alone?
Subspecialty. See, there is nothing like subspecialty. Now, if you want to, improve the quality of your particular department, just go ahead and improve the quality by taking these guidelines. You can always take the help of the NABH guidelines or JCI guidelines and improve the quality of your area or your department. For that, you don't need any kind of subspecialty or any kind of certification. You can do it all by yourself.
Ma'am, the last question is, are there any financial implications of accreditation, like would funding or grant of any approval, grant approval for hospitals be easy post the accreditation?
See, I would like to mention one thing that, accreditation, you don't have to make any kind of expenditure because they are just going to see your hospital quality program. Now, if you don't have certain things in your hospital to maintain quality, it is the responsibility of the management to provide that and maintain quality. Accreditation programs don't ask for any expenditure. They don't say, we want this kind of a flooring or this kind of an equipment, and it should be, you needn't have an ECMO machine to show an ICU and all that. No, they will just say that whatever infrastructure you have, it's fine. But what is the quality of care you are giving? So first thing, they do not ask you to spend on anything in your hospital. So there's no question of, financial or, asking for money or, spending too much of money for accreditation. First of all, you don't need it until there are, very gross deficiencies in a hospital where, you cannot manage, you cannot give quality care. So at that time, the managements will have to see to it that for the patient's sake, it is all patient-centered. So for the care, you may have to spend some money to keep your area safe, to keep your building safe. It is not for the accreditation, it is for your own self. So there is nothing like, that this is a common talk in the society that people say that if we have to go for accreditation, we have to spend a lot of money. So it's not like that. It is just your own care. It's just, if you have confidence in your quality of care, you can always call the agency and ask them to come and inspect and give you a certificate. It's just that they will certain standards, if it doesn't comply, they will give you certain non-compliances, which you can work on. You can, close the non-compliances and definitely you'll get your certificate.
That would be all from our end, ma'am. Do you have any remarks for our viewers? Or any closing statements?
Yeah, my closing statement would be thank you so much, Docplexus, for giving me this opportunity. It was a wonderful session and gave me an opportunity to speak about what I wanted to speak about, quality and accreditations in the hospitals. So just wanted to say that it is not difficult for any one of you to get your hospitals, whatever size of your hospital is, you can get it accredited by just reading the book on the standards, which is available on the websites of these agencies. Or you can call us, and we are consultants for NAC, NABH, NABL accreditations. We'll help you out, ease in, the process and we will train and help you, handhold during this process and help you get a certificate. But our main intention is to put quality in place. So if you're interested in improving quality and also simultaneously get a certificate, you can always approach us, and we'll be more than happy to help you out. Thank you, Docplexus. Thank you, Darshika. It was a very pleasant and a nice, good session. And thank you very much.
Thank you, ma'am. So this brings us to the end of the session. On behalf of Docplexus and entire team, we would like to thank Dr. Savitha for talking to us today and sharing her expert views on the importance of accreditation, the process, and how easy it can get for hospitals. We are lucky to have doctors like you who believe in knowledge sharing among the medical community. We would love to have you sometime soon again, ma'am, for such interesting webinars. Docplexus would also like to thank all our great viewing doctors for being diligent in serving the country during the pandemic. Please feel free to drop any more questions or comments if you have. Our doctor we will get in touch with the doctor and have your questions answered. For more such interesting discussions, don't forget to log on to Docplexus for your daily dose of medical news, webinars, articles, and much more. Please be safe and have a great weekend. Thank you so much. Thank you, ma'am.